All right. Welcome, everyone. We're getting ready to start here. Just waiting for a couple more people to sign on that registered. If you can hear me, please send us a happy face or a thumbs up. Yeah, we got one thumbs up. Send us a couple more thumbs up. 2, 3. Perfect. Excellent. All right, so we got good audio. And I have Dr. Shasta here with me as well. And we're going to get ready to get started here. So, welcome everyone. Thanks for spending your evening with us. So here's kind of an outline of the webinar. Dr. Shasta is going to start. She's going to give 25-minute talk. And then I'll come in, give my 25 minutes. And then if you have any questions come up, you can definitely put them in the chat box. Or at the very end, we're also going to ask if anybody has questions. You can send them in the chat box then as well. And we will do our best to answer as many of them as we can. And okay, perfect. And here we go. I want to let Dr. Shasta know we're getting started.
Good evening, everyone. It's so nice to have you here tonight. This is a subject that is very, very near and dear to my heart, as you will see later on in the talk. This is one of those ailments that can zap the life out of you like you're an old person in a young person's body, and it's extremely frustrating because many of the tests that are done miss it. So we will go through the Western causes and the Chinese medicine causes and things that can be done for it. The symptoms of hypothyroidism: thinning hair, especially losing the outer third of your eyebrow, having an enlarged thyroid.
All right, looks like she started. Are you guys able to hear her voice?
And swallow water, it will bulge out. Having a puffy face, dry skin and coarse hair, slow heartbeat, poor appetite, constipation, infertility, heavy menstruation, carpal tunnel syndrome, and chronic shoulder problems, including people tend to get fibromyalgia with hypothyroidism, cool extremities and swelling of the limbs, poor memory, intolerance to cold. And one of the saddest parts about hypothyroidism is a lack of spiritual joy. No one really talks about that part of it. Common diseases that affect hypothyroidism. If not treated, hypothyroidism can lead to a coma. It's a medical emergency. Hypothyroidism, it is an underactive thyroid gland with decreased levels of thyroid hormone. The main cause of hypothyroidism in Western medicine is called Hashimoto's thyroiditis, and that is where the immune system attacks the thyroid, causing inflammation and damage. The thyroid is a very small gland shaped like a butterfly located in the lower part of the neck. The function of the gland is to secrete hormones. The hormones deliver energy to the cell of the body. It is estimated that 13 million people in America are affected by thyroid disease, and it mainly affects women. They don't know exactly why it affects women, but I think with the sensitivity of all the hormones in women, we are a little more susceptible, and we generally are a little smaller, so chemicals affect us and our livers more and would then affect our thyroid. Other common diseases that affect hypothyroidism are Graves' disease. Graves is an hyperactive thyroid, and when you get Graves' disease, you can have it treated in a way that they'll cut some of that out, or they'll do radiation on it, and then you'll end up with hypothyroidism. Thyroid cancer, it's 90% curable, thankfully. Thyroid nodules, if people have thyroid nodules, you still want to know that they're suffering from thyroid problems, even though the Western doctors will tell you that you're not. Goiters, it's the enlargement of the gland. In the past, these were common due to lack of iodine. These can compress the vital structures of the neck, and so people will feel what Chinese medicine calls a plum pit feeling in their throat, or feeling like it's hard to swallow or someone's choking them. This is when the thyroid gets bad. The modern Western approach is to treat it with medications like Synthroid, Levoxyl, Cytomel, Armour. There is a liquid T4 medication called Tirosint, which does not have lactose for those who are lactose intolerant. And it is important to keep in mind that as many as 40% of clinically hypothyroid patients, mainly women, have significant depression, because when you have sluggish thyroid, you have sluggish metabolism. And the gut is our second brain that makes our happy hormones. So when people have hypothyroidism, they won't be as happy. It is harder to be happy. So we have to be kind to those people and help them get their fire going inside of them and feed their happy bacteria. So hypothyroidism symptoms, we went over this already, but allergies, headaches, polycystic ovarian syndrome, adrenal dysfunction. People don't think that, slow healing. So if you're a practitioner, you have a patient come in and they have carpal tunnel and shoulder problems, and let's say low back pain, and it's just not healing well, a lot of times that can be a low thyroid involvement. Root causes, we just went over that, but stress can cause hypothyroidism, because when you have more stress hormones, your thyroid will slow down, so you don't have too much stimulating hormones in your body. Poor diet, so if you eat nutrient poor foods and fast burning, high glycemic foods, you will have an up and down of your blood sugar, and that causes a stress response in your body that will affect your thyroid. Not having good circulation. Pregnancy, a lot of times people come down with hypothyroidism after pregnancy. Taking synthetic hormones can, especially estrogen, can affect your thyroid. Lithium, failure of the pituitary gland, zinc deficiencies, and personal care products that have xenoestrogens like parabens and fragrances, etc., in them that mimic estrogen and throw off the body's cycle of hormones. In traditional Chinese medicine, we look at the body as a whole, not as parts. As Western medicine looks at it more like a machine, we look at it as a whole. And you can see this yin and yang symbol. This is a symbol about how there's yin qualities to us and yang qualities, and there's always a little yin and yang and yin. And these are basically qualities such as male, female, fire, water, night, day, fast, and slow. And in our society, women are always on the go and pushing, and that tends to increase the male hormones in the female body, decrease the female hormones. And when we increase our male hormones, our thyroid is going to slow down, because again, we can't be overstimulated. So the approach is to tonify the kidney, heart, spleen, and yang, because the fire has gone out, nourish the liver and kidney yin, and tonify the overall energy of the body. The spleen houses the emotions of worry. The lung houses the emotions of grief and sadness. And the kidney houses the emotion of fear and insecurity, and is the root of all other organs, which includes the functions of what Western medicine calls the adrenal gland, sex hormones, female, male reproduction, cortisone. And it can show up as cold hands and feet, chronic low back pain, immune systems issues, infertility, and more. So when your thyroid goes down, it's a full endocrine hormone imbalance all the way through the whole body. And in Chinese medicine, they say deficient kidney, spleen, and heart yang, meaning the fire is out in all three of those organ systems. The herbal support is to tonify the kidney, the heart, and the spleen. Yang, and yang means fire. Is also to nourish the kidney yin and tonify the qi of the body. So therefore, it must address the yin and the yang. And we call this the triple warmer. The thyroid has to do with the triple warmer, which is 3 different warmers, the lower, the middle, and the upper, that regulate the metabolism, absorptions of our nutrients, and the regulation of our fluid metabolism through the body, which is why people with hypothyroidism get swollen and they get aches and pains everywhere, because their lymphatic system doesn't drain, and they also don't have a complete evacuation of going to the bathroom. So toxins build up. So hypothyroidism, Chinese herbal formulas. You guys could take a picture of this with your phone if you'd like. There is a wonderful formula called Thyrobin by Rejuvica Health that I personally love and take. It's a wonderful liquid formula I get online that has a lot of the essential nutrients needed when you have hypothyroidism. There's also Plum Flower brand is a great Chinese herbal patent company that you can find online that sells classic patent formulas. Romania 8 would be a good one. Jingwei Hen Chi Wan would be a good one. Xiao Ya Wan, Wei Pi Tong, Chen Wu Tong Vitality Combination, and Gui Lu Xian Jiao, tortoiseshell and deer antler. So these are the classic formulas used. Many of them have tonifying, very high nutrient-rich herbs in them to thicken the blood, so that your blood sugar lasts longer and you don't have the spikes of up and down of insulin and cortisol, because all of that causes inflammation and deterioration of the body and autoimmune. So nutrition suggestions, please feel free to take a picture of this. Eat plenty of the following. We recommend when you have your fires out, which is hypothyroidism, we recommend eating mostly all warm cooked foods and drinks. Having complex carbohydrates, we suggest 60 grams or less of sugar a day, of carbohydrates a day, 25 grams or less of sugar. Avoiding the gluten, because the gluten is a very highly processed protein in America that the gut has a hard time absorbing and leads to allergens and then autoimmunity. It is found to be the #1 cause of Hashimoto's is the gluten in America. They soak our wheat kernels for 3 days in a pesticide, and they infuse it with a Bt toxin, which is used to split the bug's stomach. So it's a natural pesticide. And 3rd generation of mice who eat this are completely infertile. So we should eat all organic. Almonds, beans, a little bit of fermented food, like Greek organic yogurt, sauerkraut, a pickle, apple cider vinegar, gut shot. I like gut shot. Beans are very good because high fiber feeds the healthy bacteria in our gut, which is needed with hypothyroidism, as well as to help you with constipation. The Mediterranean diet has been shown to be very helpful, and having bone marrow broth and adding a lot more healthy fats to your diet, such as olive oil, organic butter, organic coconut oil, and avocado. More healthy fat creates more healthy stress hormones and female hormones, and also helps with constipation. So this is more of what we said. Please feel free to take a picture of this. I like the zone-friendly type diet, which is at the bottom of this page, where you eat 40% complex carbs, 30% healthy fats, and 30% protein. It's a zone-friendly diet with every meal and snack. Organic eggs are extremely healthy for hypothyroid people because they are the most yang food and very much needed. Soy products should be avoided because, number one, even if they say they're organic in America, only 5% of it has to be organic for them to call it organic. So they have a lot of pesticides. And number two, they slow down the thyroid function. Supplements, iodine, which is controversial. I don't recommend it. I just recommend eating some kelp in your diet. And dulse, D-U-L-S-E, is a seaweed powder condiment, D-U-L-S-E, that you could put on your food that would get you some natural iodine. Selenium, vitamin D. A good way to get your vitamin D is through cod liver oil and getting out into the sun. Let's continue. A wonderful healing soup that can be a Mediterranean style soup is in my book, The Amazing Healing Power of Khichdi. I have a Mediterranean khichdi soup in there, which is mung beans, a Balti curry powder, which is very mild curry, but it has that spice that a hypothyroid person needs, and lots and lots and lots of vegetables. I have a video of me making that soup on my website under the videos. And if any of you want the recipe, please email me at tonight, and I'll get it to you tomorrow. Things that can interfere, certain supplements. We talked about that. And lifestyle suggestions, drinking plenty of purified water, taking a rest in the middle of the day so that your adrenal glands get a break, so that they don't pump out more stress hormones and slow your thyroid down. That's why getting enough sleep is so important for our metabolism and our thyroid, because when we don't, we start to run off of our stress hormones, and it tells our thyroid to slow down. Meditation is very, very good, and yoga. These are some acupressure points. I do have a yoga video on my website. It's called Chi Yoga for Hypothyroidism. It is a free downloadable 10-minute video. It has some of these points in it. You find it on my website under the products and then videos, and then you can have it emailed to you for free. So why I told you this is near and dear to me is because I almost died from hypothyroidism. That was me before, and then that was me after I got my thyroid working right. I struggled my whole life with my weight, even though I ate really well and was incredibly athletic. And I couldn't understand why I was so puffy. By the time they found my thyroid problem, I was 32 years old, and my blood pressure was only 95/45. I had chronic fatigue, fibromyalgia, a disabling shoulder injury, and a herniated low back. And this acupuncturist said, "You're like an old lady." And I was like, "I know, I really think I'm dying." But because they didn't do a comprehensive panel, they only did a TSH, my thyroid problem was completely missed, which was autoimmune hypothyroidism, Hashimoto's. And I had a miscarriage and everything. So this is why I love to help people with this problem. There's my friend Sarah Fields in this video with me. Hi, Sarah. Sarah's on this call tonight. So these are a lot of the tests that should be done. Please feel free to take a copy of this with your phone right now. I'll give you a moment. This is a very comprehensive what should be done. But again, I think we should have a comprehensive panel if we or someone we love is suffering. I lost 10 years of my life to being very disabled by this disease. And the doctor said that he thought I'd had it my whole life. And he said I would not have lived another 3 to 5 years with how sick I was by the time they found it, even though I'd been going to my doctor every year to get tested. So I put this together for you guys. please take a picture of it. It's very important. And if you think you have hypothyroidism and your doctor won't listen to you, you need to find a doctor that first of all, Dr. Ernesto and I work with this. Secondly, a Western doctor, somebody who listens to your symptoms more than your tests. You can take a picture of this. This is some more information about the functional nutrition exam testing. Other autoimmune diseases to watch for. If you have Hashimoto's hypothyroidism, you have a much higher chance of getting a second autoimmune disease because it means your immune system is compromised. So it's important if you have Hashimoto's to make a copy of this so that you can watch out for these other ailments, because you want to make sure to get tested and know ahead of time if you have it. So you can go ahead and take a picture of this, the wellness checklist. These are things that just have to do with a mind, body, and spirit wellness plan, because everything is connected. So I put that together for you guys. I got it from the Blue Zones study, which was a study around the world of the 5 places around the world where the people live the longest and happiest. These were the main things that they learned. Sources of information. This is where I got my information. And as you can see, those chakras there actually correlate to the endocrine hormones. And the throat chakra one has so much to do with communication. So when we suppress our communication, we don't stand up for ourselves, we're in an emotionally abusive relationship, that also can affect. Feel free to contact me for a free consultation if this is something that you're dealing with. I'd be very, very happy to help you. I've helped lots of people with this. It is a passion of mine. And thank you all for being here tonight. Thank you. Okay, Dr. Ernesto, I'm going to hand
All right. Perfect. Thank you, Dr. Shasta. So I'm going to switch gears here. Pull up my presentation. I switched the mic, so let me have you guys just give me another thumbs up to make sure you can hear me and you can see my PowerPoint. Perfect. All right. Excellent. So let's get into it. We're right on schedule. So that was a great presentation by Dr. Shasta. A lot of what I'm going to be talking about overlaps basically what she just told you guys about, which is great. I'm just going to present it in a little bit of a different way, with some other different points emphasized. So for those of you who do not know me, again, my name is Dr. Ernesto Medina. I'm a chiropractor, and my practice is in Campbell. I run a functional medicine and neurology-based health center. Let's get into it. So the thyroid gland, just like Dr. Shasta was saying, is a very important gland and organ system. It essentially influences every single cell and organ system in the body. Anything from brain development and brain function to metabolism to digestion to bone formation. And so when the thyroid does get messed up, symptoms can really be anything, which is frustrating, and can also lead sometimes doctors in the wrong direction as far as not testing it appropriately. And so, like Dr. Shasta said, working with a doctor who is very well trained in assessing the thyroid, which we're going to talk more about, is super important. Um, so, what is the problem? In my opinion, thyroid issues are probably the most poorly managed organ system in conventional medicine today due to the very poor standard of care that exists. It's estimated about 50% of people with thyroid conditions actually go undiagnosed. And those that do get lucky enough to get a diagnosis many times are misdiagnosed or not being properly managed with the medication that exists. And 75% of those thyroid conditions are largely women. The estimate is about 1 in 8 women. Remember, 50% of those don't actually get diagnosed. Really, we're looking at maybe 1 in 4 women having a thyroid issue. So it's a very, very common issue. And like Dr. Shasta had mentioned, some of the most common symptoms are going to be dry, brittle hair or hair loss when you brush it, chronic fatigue, uncontrolled weight gain, and chronic aches and pains. So just like Dr. Shasta was saying, she had been diagnosed with fibromyalgia. Chronic aches and pains that don't go away, typically you'll get diagnosed as fibromyalgia. But fibromyalgia is really just a symptom. It's not a core cause of some kind of disease process. So in that case, thyroid was the contributing factor. And then chronic constipation can often be a big symptom as well. So the question becomes why? Why do so many women have this issue? Why do so many people get undiagnosed and misdiagnosed? So that's what I'm going to answer for you guys. So my essential tip number one, like I mentioned before, is that the medical standard for assessing and treating thyroid function is grossly ineffective and incomplete, even today. The medical standard of care, so for those of you who don't know what that means, medical standard, the official definition is the type and level of care an ordinary, prudent healthcare professional with the same training and expertise would provide under similar circumstances in the same community. So essentially, it means the bare minimum of care a doctor must perform to not be considered negligent. So imagine if all doctors across the country are trained the same bare minimum to assess your thyroid, that's going to be the standard of care, and you're not going to get any more in depth with that. All right, and so going to the next one here. So, what is the standard of care? In conventional medicine, it is measuring TSH, and in rare cases, you will also get your T4 measured, and that's pretty much it. If you belong to the Kaiser Network, the Health Network, Stanford Healthcare Network, pretty much they're all just going to test your TSH, and that is it. But as we're going to talk about right now, oh, one more point before I get into that is that the other thing you need to know is that there's about 8 or 9 different markers that should be measured for a full thyroid panel, and conventional medicine is only testing 1, maybe 2 max. The other big thing you need to know is that the standard range of TSH is humongous. So if you look at normal, it'll range from lab to lab, but roughly it's around zero point 0.4 to 5, something like that. And so if you get your TSH tested and it comes back 0.5, you're going to be told, oh, your thyroid is normal. Nothing to worry about. But you can see that range is so big, it can be at 4.99. And again, they tell you, oh, you're fine. You're basically told you're the same as someone with a TSH of 0.5. And that is not right. That range is way too big. And I see patients suffering from thyroid issues with anything below about 1.5, and anything over 3. So my range that I like to use is 1.5 to 3, and I try to keep it in the middle of that as best we can. When patients start to fall outside of that range, usually they start to experience symptoms. But again, in the conventional medical model, they're going to be told, oh, you're fine, everything's normal, and you won't get diagnosed and you won't get any kind of treatment or help, but your symptoms will continue. And so back in 2001, even the American Association of Clinical Endocrinologists, who are the hormone specialists in medicine, put out a public statement saying that even though TSH between 3 and 5 is in the normal range, it should be considered suspect since it may signal a case of evolving thyroid underactivity. So again, if my range is 1.5 to 3, they themselves are saying anyone with a TSH between 3 and 5 is likely suspect to be having underactivity of their thyroid. But even though this statement was put out in 2001, the standard of care has not changed since then. Very frustrating. So this is what a full thyroid panel should look like. And this is the full thyroid panel we always run on every patient when they come in here. You can see all the different markers that are there. They are all relevant, and I'm going to explain why, but they all must be tested to properly assess if a person's thyroid is off or working properly. Essential tip number 2, there are 24 different causes of a low-functioning thyroid, and commonly prescribed medications only address one of those 24 causes. The other 23 are caused from diet, lifestyle, or some sort of nutritional deficiency. So what I want to do with you all is I want to walk you through how the thyroid works. So those of you who have just called in and are not watching this, I'll try to explain it as best I can. But we'll also provide you with a recording at the end of the webinar in your email. So essentially, I want to walk you all through how the thyroid works so you can better understand this than your primary care doctors, essentially. So what you need to first understand is that all thyroid function begins in the brain. If the brain does not properly signal the thyroid to function, you're not going to get good thyroid hormone production. And that signal from the brain to the thyroid is TSH. And that is what is the most commonly measured marker on a blood test to assess your thyroid. Now, when that activation occurs, the thyroid then turns on and produces T4. T4 is a thyroid hormone, but it is an inactive form. So it's of little use. It must become activated. That activation converts it into what's called T3. T3 is the active form. But again, if you go to your conventional doctor and you have your TSH measured and maybe your T4, you're not going to know if you're having a conversion issue making T3 or not, right? They're only interested in knowing, is your brain talking to your thyroid and is your thyroid making T4? And that's the end of the story. But we want to know, are you able to convert that T4 into T3, which is the more important and the more active form? Now, that conversion of T4 to T3 occurs 60% in the liver, 20% in the intestines by your microbiome. So the good bacteria that should be in your digestive tract converting T4 into T3. And then the last 20% is converted in free floating in the blood. Now, T4 doesn't always convert directly into T3. It can also convert into reverse T3, which again is an inactive form of the hormone. So that it is again an undesirable form of thyroid hormone. The only reason your T4 would convert into reverse T3 instead of T3 is because you have underlying inflammation. Inflammation is the primary driver of converting T4 into reverse T3. So again, that's where diet, nutrition, and lifestyle and minimizing inflammation through those factors helps with healthy T4 to T3 conversion. In addition, that T3 that is, once it's activated into the most desirable form, then converts over into a marker we call T3 uptake. That basically tells us if active T3 is binding to cell receptors and creating a desired action, right? Now, as you can see in this graph here, the biggest inhibitor of a healthy T3 uptake number is going to be too much estrogen hormones or too many testosterone hormones in your system. So this is where Dr. Shasta was talking about how certain cosmetics and creams and fragrances have hidden sources of estrogen, or xenoestrogens as they're called, which can block your T3 binding of cells, which will in turn affect your whole thyroid. And too much testosterone. So PCOS, for example, in women, polycystic ovarian syndrome, often due to high testosterone levels, will also contribute to a messed up thyroid. Birth control can oftentimes be a hidden cause of thyroid issues because it messes up with your T3 uptake values. Okay. So like I mentioned before, if medication only addresses one of the 24 causes, the other 23 are caused by some breakdown in this entire system that I just showed you, either due to chronic systemic inflammation, too many stress hormones, or too much stress in your life, testosterone estrogen imbalance from either birth control use or cosmetics, high grain, high carbohydrate, sugar diets, some sort of nutrient and vitamin deficiencies, because the liver, remember, if 60% of that conversion of T4 to T3 happens in the liver is highly dependent on all types of vitamins, especially B vitamins and things like that. So if you're deficient in those things, the liver is going to poorly convert T4 into T3. An imbalance in serotonin and dopamine levels. So remember our last webinar, for those of you that joined us, we talked about the holistic approaches to mental health. And serotonin and dopamine are major brain chemicals that help with mood, regulating mood and happiness and joy. And so when that system is off, it'll mess up your thyroid. And likewise, if the thyroid is off, it'll throw off those chemicals as well. And a bad digestive system. So eating the standard American diet, high in processed foods and carbs and sugars and processed fats, not healthy fats, but processed fats, will cause messing up of your liver, of your gallbladder, and of your intestines, and your good bacteria in your intestines. And then autoimmunity is the other big contributor to thyroid issues. So tip number 3, which built on the autoimmune factor, is that 80 to 90% of all underactive thyroid conditions are due to an autoimmune reaction attacking the thyroid, and that's called Hashimoto's. So 80 to 90%, that means the majority of low thyroid people have an autoimmune disease. It is not necessarily a faulty thyroid, but a faulty immune reaction. That immune system is attacking and destroying your thyroid, messing up that whole cascade I just showed you, and throwing off your hormones. When this is the case, management strategies must be aimed at balancing the immune system, not just medicating the thyroid. But again, if primary care doctors do not ever do the full thyroid panel and they do not ever check to see if you have the Hashimoto's component of low thyroid, they're not going to know how to that you have it, and they're not going to know how to address it. And to be honest, I think most doctors don't actually test it because there's no medication that they can give you to address it. So they choose to ignore it because the medication is not going to change. And in our world, it's very important for us to know this, because the most influential things that will balance your immune system are going to be diet and lifestyle and targeted supplements and stress reduction, doing yoga like Dr. Shasta was talking about, and finding balance in your work family life. Okay, those all change stress hormones and they manage the immune system more effectively than any medications that exist. Okay, so in this diagram, basically it's the same exact diagram, except what I'm showing you here now is that there's an added component of difficulty in that the immune system is actively attacking and destroying the thyroid, which then causes a whole downstream effect, messing up your T4, changing your T3. Um, Autoimmune issues will often affect the digestive tract and create inflammation. And that inflammation will actually impede the brain's communication to the thyroid. So it creates a whole cascade of issues. And like I said, there's no thyroid medication that exists that is going to fix that entire immune inflammation response that is happening. It's only going to try to fix your TSH level, and that's it. All right. Um, Let me give you guys an example. The most commonly prescribed medications right now, basically Synthroid or levothyroxine, are only synthetic T4 replacements, right? Because remember, most doctors are only checking your TSH and your T4. So when those numbers are off and you're low thyroid, they give you levothyroxine, synthetic T4, to try to improve your TSH. However, they don't know if that T4 they are giving you is even converting into T3. They don't know if it's even just a T3 issue, not even a T4 issue, because they're never even checking. And they don't even know if it's an inflammation issue causing poor conversion of T4 into reverse T3, or if it's the birth control they've given you causing the issue. Um, and so the levothyroxine and the Synthroid oftentimes will cause temporary relief of symptoms, but within a few months, your symptoms come back. You go back to the doctor, your TSH is off again, and they increase the dosage. And this is a common cycle that happens every year or every 6 months or every so many months, and there's never any end in sight, right? So the majority of the patients we see have already been medicated for months or years, and they continue with the same symptoms. And the reason for that is because none of the other mechanisms were ever looked at, evaluated, or addressed, right? So again, balancing the immune system should be the focus of these Hashimoto's cases. And the way we do that is identifying inflammatory foods that are contributing to inflammation and messing up the digestive system, regulating the immune system with targeted supplements, healing the digestive tract and the digestive system, exercise, and managing psychological, emotional, and physical stress. So the take-home message here for everyone is that proper thyroid function is dependent on a complex interaction between your brain, your thyroid gland, your digestive tract, and your immune system. They all feed into each other and they can all influence each other in a positive or a negative way. So when there's a break in that chain, there's going to be downward consequences. There are over 20 different causes of an underactive thyroid condition, and medication addresses only one of those. Up to 90% of all underactive thyroid conditions are due to an autoimmune dysfunction. The stress you experience, cosmetics you use, foods you eat, and medications you take can all influence the function of your thyroid. Perfect. Let me see. I want one more thing. Okay, perfect. So just like Dr. Shasta, I'm also offering a free 30-minute consultation to all of you who have attended or registered for this webinar. If it's your first time checking out our office, here's the website. It's www.sjchiro.com. That's sjchiro.com. Our office phone number is 408 755 5710. And again, if you're interested in booking this free consultation, you must do it within the next 48 hours because we know that you at least attended this webinar or you received the recording and you're serious about getting yourself healthy and your thyroid healthy. As long as you contact us within the next 48 hours, I will honor this free consultation for you and we'll get that scheduled right away. Even if you have some old blood tests with you from your other doctors, you can bring those in. I'll take a look at them, let you know what you're missing, what else needs to be ordered to get you started on track. All right. Thank you very much. Let me unmute Shasta here. And if there's, I'll open it up to questions for you guys. Be sure to send them in, put them into the chat box. Questions, no questions. Let's see. All right, doesn't look like anybody's got any just some comments. Great, we appreciate that. All right. Oh, yeah, we do have a question. Let's see. What foods do you recommend for hyperthyroid? Okay, so good question. We didn't talk about hyper. I'm assuming you mean hyper, high functioning thyroid as opposed to low functioning thyroid. If that's the case, we didn't talk about high functioning or hyperthyroid because that is much less common than hypothyroid. But all hyperthyroid cases are autoimmune based, which means you do have an autoimmune disease. Usually they must be managed by an endocrinologist, first of all, because high functioning thyroid issues can be very aggressive and can cause pretty severe symptoms. But again, it's autoimmune based. So the same treatment program and food recommendations apply. Essentially, decrease processed carbs and grains. A really easy outline that I use for patients is called the autoimmune paleo diet. And you can Google that and you can look it up what autoimmune paleo stands for. And it'll be a whole breakdown of the foods you should avoid, but essentially, really avoiding of wheat, soy, dairy, and which are the major contributors. From there, I hope that helps. Again, it should be managed by a endocrinologist always. But there's a lot of things that can be done nutritionally, lifestyle based that'll help. So we do have a question regarding what can you expect from the 30-minute consult? Essentially, we'll talk about kind of what's been going on in your history. You can bring in old lab tests, like I mentioned, and we'll take a look at what's missing, what else needs to be ordered. And then we put a specialized program together for you. Assuming if you have the autoimmune component, it's going to be a whole diet, nutrition, and lifestyle. Finding out specifically through additional blood testing where your deficiencies are and fixing those. And going from there. But every program will be targeted to the individual. And you can see Dr. Shasta is also commenting in the web chat that her program revolves around something similar by using acupuncture as well. And you can see her recommendations there. Any other last-minute questions? No, I think that's all we got. Perfect. Well, thank you all for joining us. We're finishing a little bit early so you can all get on to your dinner and enjoy the evening. Again, if you want to take advantage of the free 30-minute consults that both Dr. Shasta and I offer, make sure you contact us in the next 48 hours. We will send you guys a recording of the webinar tonight as well so you can rewatch on your own. All right. Thank you very much, guys.